you came here in 2009, you had a great reputation at Penn for being the provost. Why did you want to leave Philadelphia, and why did you earlier leave Toronto to come to Baltimore?
Well, I came to Baltimore first and foremost because of the tremendous opportunity to lead Johns Hopkins University. And I was on a path, having been provost and dean, as you noted, but to take on a leadership role at the helm of the university. And the opportunity to lead Hopkins, this vaunted institution, but particularly an institution located in a city, as you indicated before, that's got immense assets, but also some challenges. I thought this would be a great opportunity to use the launching pad of Johns Hopkins University to think about how we could become a more deeply integrated force in the city and contribute to its welfare.
Now, why didn't Johns Hopkins just say John Hopkins? Why is it Johns Hopkins? Has anybody ever made that mistake of calling it John Hopkins? And why did he have the name Johns? Why didn't he just get rid of the S?
There's a great story of Milton Eisenhower, who was Dwight Eisenhower's, you would know, of course, Dwight Eisenhower's brother, who was president of Johns Hopkins. At one point during his illustrious career as president of Johns Hopkins University, he was honored with an honorary degree from the University of Pittsburgh. And when they called him to the stage to confer the honorary degree, they said, and please give a rousing welcome to Dr. Milton Eisenhower of Johns Hopkins University. He, not missing a beat, said, "It is great to be back in Pittsburgh." So there you go.
Okay. So let me just ask you a final question before we get to the others, and I'll come back to you. What have you done as the president of Johns Hopkins to try to make Johns Hopkins a more important part of the fabric of Baltimore, as opposed to just saying we're an isolated ivory tower kind of school, we just mind our own business? Why are you trying to spend so much time making Hopkins a more important part of the city of Baltimore?
Thanks, David, for the question. And as you know, from the moment I got here, it was very much a result of the experience that I had at the University of Pennsylvania. We're first led by Judy Rodin was president. I came to the University of Pennsylvania under Amy Gutman. But it was this epiphany where University of Pennsylvania realized that it was in West Philadelphia, it was in the city of Philadelphia, and it had really seen itself as an Ivy institution, but distant from the city. And under their collective leadership, this university really reoriented itself to engage deeply in the city in a number of different dimensions. And for me, coming to Hopkins, I saw the same opportunity here. And first and foremost, it was in the context of a project that had started before I had come to Baltimore, but one which I was very much responsible for championing, and that was the East Baltimore Development Initiative, the largest urban redevelopment project in the United States at the time, 88 acres in the surrounding community near our medical school campus. And it was opportunities like that to think about ways in which we could be much more intentional in impacting the neighborhoods around us, but the city writ large. And I would say that in so many different dimensions, over the last 15 years that I've been lucky to be here, what we've been able to do at Johns Hopkins is to make that sense of citizenship, of really being located in the city and understanding the opportunities that we have to pursue our mission, but do so in a manner that has direct and demonstrable impact on the city of which we're part. I think it's just become much more natural and easy. And I think as a consequence, what to me is most marked is how faculty, students, staff who are at the university just now see themselves more readily as advocates for the city.
If you get sick and you're the president of Johns Hopkins, do you have to try to get a doctor? Can you get right in to see somebody at Hopkins?
I call your office to see if you have any influence with seeing if they'll expedite my access to.
So Clark Kerr was the famous president of the University of California, and he made this famous statement that you no doubt know, and I'm going to say. He said, all you have to do to be a university president is provide parking for the faculty,
sex
football
for the
alumni,
undergraduates,
and sex for the students. Is that still the case?
Our students are no longer interested in sex.
Okay.
It's academic achievement first and foremost.
Okay. So Brooke, tell us, what does the Comptroller of Maryland actually do?
It's a great question, and I will start by saying it's really an honor to be up here with all of you today and to be on this side of your questioning. I've read many of your books, and so now I know what it's like to be on the other side. The Comptroller of Maryland is a pretty fascinating position. There is no other elected official with my job description in America. I've been looking. So the Comptroller is like the elected CFO of the state of Maryland. The Constitution says that I have general superintendence of the fiscal affairs of the state. In other states, that could be there's a revenue administrator who's appointed by a governor, there's a treasurer who's maybe elected by the population, and maybe there's a controller or a comptroller, but they're within another agency somewhere. Here in Maryland, we decided, we passed a constitutional amendment in the 1800s to say we want an independent advocate. We want somebody who's keeping an eye on the books, who can speak for the people of Maryland independently from the governor, independently from the General Assembly, and so that's what I do.
Okay. And you think the tax rates in Maryland are high enough?
I will leave that to the governor to address when he's here later today.
Okay. So you went to Dartmouth.
I did.
And where did you grow up, in Montgomery County?
I was born in D.C. and then raised in Bethesda.
Montgomery. So Dartmouth's a great school, but it's in the East Coast. Then you went all the way to Texas for law school. Why did you go all the way to Texas? Not that it's not a great state, but how did that come about?
So I went to Dartmouth undergrad, and I helped start a nonprofit there and worked at that nonprofit in Vermont. Then I went and joined Paul Wellstone's campaign in Minnesota in 2002. Then I worked for Howard Dean's campaign in Wisconsin, and then I started looking at law schools, and I said, I really got to get south. So I applied only, I had done the private college thing, so I applied only to public universities, and I applied only to public universities south of the Mason-Dixon line. And driving home one day, I was working at the Center for American Progress for John Podesta. Driving home from Wisconsin to DC to take that job, I heard Lyle Lovitz, that's right, you're not from Texas, but Texas wants you anyway, come on the radio, and I said, that's where I'm going.
Okay. And so when you first ran for office, was that intimidating? Had you been a student leader running for office in student, or all of a sudden you decided to run for the House of Delegates? Was that easy to do?
No, I had not run before. I had worked on campaigns in field. I knew how to knock doors. I had watched my father run in the past and lose, and actually my brother had run for delegate earlier, my younger brother, and lost. But I moved to Baltimore, which was sort of a radicalizing experience in my life,
okay.
I'll be honest. And that really, I was standing my first day of my federal clerkship waiting for the number 10 bus to come on Eastern Avenue in Fells Point, where I lived, and it did not come. And I got very frustrated at the lack of good public transit to get around. I went to see the public schools where my kids would go, and was very frustrated to see how different they were in Baltimore City versus in Bethesda, and said, this isn't okay. The state cannot be a truly great state until Baltimore City reaches its full potential. So threw my hat in, knocked on 14,000 doors, and the rest is history.
So do you fill out your own tax return?
I do not.
Oh. Okay. What percentage of people fill them out, do you think? It's too complicated, people don't fill them out themselves?
It is too complicated. I'll say, it's a source of frustration to me, and it's part of the reason that we're joining the IRS Direct File initiative, because this is one of the things that the government mandates the majority of Americans to do, and yet we make it very difficult.
Okay.
So we're all about making it easier.
Okay. So, doctor, did you go to medical school first or business school first?
Medical school first.
All right, so you get a medical school degree. Your parents are proud of you, I assume, right? You get a medical school degree. When you told them you're going to get a business school degree as well, what did they say?
They thought I was crazy. They didn't understand.
Why did you do that? Wasn't being a doctor good enough?
Being a doctor is foundationally how I identify myself. But about halfway through my career, I grew up on the faculty in the School of Medicine at the University of Maryland and fell in love with academic medicine. So when you think about academic medicine, think about the mission of providing highest quality, cutting-edge clinical care, educating the future healthcare workforce of our communities, of our states, of our nation, and think about innovation. So thinking about the responsibility of defining the cures of tomorrow while we're delivering care today. And I loved it. I loved everything about it. In our organization at the University of Maryland, we are a private, not-for-profit health system with a symbiotic relationship with a public university. And in our world, having physician voices on the health system side, at least as I was growing up professionally, was not nearly as common. And so as the system grew and had impact across the state, there was opportunity. But that opportunity would require, as a physician leader, getting business education. And so that opportunity was provided to me, and I...
Where did you grow up?
Born in Philadelphia, grew up in South Jersey, Cherry Hill, New Jersey.
And when you tell people you're in Baltimore, not Philadelphia, what do they say? You're lucky, or what do they say?
So, Philly's a town of passion, but it has a lot of commonalities to Baltimore, right? And so I would say as long as the Eagles aren't playing the Ravens or the Phillies aren't playing the Orioles, the two towns actually, there's a lot of synergies. I think some of the opportunities and some of what differentiates Baltimore, obviously I'm a bit biased, but I would say the healthcare ecosystem is a very unique asset.
So in Philadelphia, they have something called a cheesesteak. Is that healthy for you?
Radiation oncologist, but even my minimal training in cardiac disease would tell you the answer is no.
So you're an oncologist?
Radiation oncologist.
Radiation oncologist. So the best way to avoid getting cancer is what? Eat healthy, have good genes. What's the best way to avoid getting cancer?
There's controllable and not controllable. Your genetic lottery determines some of that. But I think you're right. It is about healthy living. So it's exercise, it is nutrition, absolutely. And then there is the reality of environment. And so we all have a collective responsibility to lean into those things that we control. And environment is one of those examples where we can make purposeful decisions to keep our collective society healthier by the way we act.
All right, let's suppose I want to be loyal to Baltimore and I'm sick. Should I go to University of Maryland Medical Center or Johns Hopkins? What would you say?
So what I'm going to tell you is one of the realities of this community is we are blessed with healthcare choice. We are blessed with high quality healthcare choice. And that is not a given all across the state of Maryland or around the nation. And
You might want to stop there.
Right.
It's good so far.
Yeah. So, I would tell you, again, where you live shouldn't determine your healthcare outcomes. And some of our realities is in Baltimore, despite many of the challenges, one of the realities is we do have phenomenal healthcare. Obviously, I'm a little biased. I'm going to tell you that if you're sick, you come down to Green Street in Baltimore,
Okay.
we got you. But my friends and colleagues on the east side would tell you.
You wouldn't want everybody to know what you have at the University of Maryland, so would you not sneak over to Hopkins?
I don't know. I delivered my babies at Mercy.
Right.
Yeah, so optionality matters, Brooke. Optionality matters.
So in the history of American education, no person has given more to one university than Mike Bloomberg has given to Johns Hopkins. I think you've persuaded him to give roughly $6 billion, more or less. And I understand there'll be more coming at some point. You can't say that, but so...
Why don't we discuss your payroll again?
Okay. So tell me, how did you did you know Mike Bloomberg before you became the president of Johns Hopkins?
No. I met Mike for the first time between the time that I had been nominated by the trustees, but before it had been rolled out officially.
So, I mean, the staggering amount of money that he's given, nobody in the history of our country has given that much to any university, and I think he's got more to give, as I understand. So, what do you do when you see him? Do you just kind of just say, I have a good idea for another $1 billion or so?
You know, it's been an amazing run with Mike. I mean, the level of conviction that he has for Hopkins is truly extraordinary, but the truth is, at the same time,
Okay.
Mike would have the funds to take
He'd
care of
fix it,
that.
Yeah.
What he's done for Hopkins is extraordinary, but what he's done for higher education and so many other different philanthropic institutions is amazing. In my case, it typically starts with a conversation. We have an idea about something that we want to have impact on, and Mike is, he's curious, he's interested, he's challenging. You know, he's got, as you know, capacity to see quickly through an argument to see whether or not it holds or not. But the thing that's amazing is if Mike is persuaded that the idea is good, that it can have impact, that it will have transformative potential, then at that point he's been enormously
So have you ever
generous.
gone back and looked at his application to get into Johns Hopkins? Does it still exist? And was he narrowly accepted or easily accepted?
Mike always says that there'll be monuments at Johns Hopkins. There'll be one for the first president of the university. There'll be one for the admissions dean who actually admitted Mike Bloomberg.
Probably true.
To note in all posterity for what he did. But he's very self-effacing, but the truth was he was an extraordinary student when he was at Hopkins.
East Baltimore has had its challenges, as we know. Lots of issues in East Baltimore. But Johns Hopkins Hospital and Medical Center is in East Baltimore. So how have you tried to fix East Baltimore and make it more acceptable to doctors who want to work there and patients that want to come there?
So first and foremost, as I mentioned a moment ago, I think the most significant enterprise that we've been involved in is the East Baltimore Development Initiative. And that was this 88-acre project that was really designed to fundamentally reconceive and strengthen the communities around the East Baltimore campus. And it's not yet entirely complete, but over the last 20-plus years, it's been challenging at times, but there's been a lot that's been accomplished. There's a fabulous new school that was built in East Baltimore that we actually we operate with the public school system. There's a hotel, there's a large urban park, there's new housing, commercial activity. I think that in one very direct way is a way in which we've been able to impact the neighborhoods. I would say the more fundamental way in which we have impacted East Baltimore and the city more generally, and it's a very simple idea, was just to become much more intentional in the way in which we thought about procurement, construction projects, and where we were hiring people to come and work at Hopkins. And in all those dimensions over the last 8 or 9 years, we've had a program called Hopkins Local, which has really put out clear targets, clear accountabilities, clear annual evaluation by third-party validators, where we have really sought to use our procurement, our construction, and our hiring abilities to strengthen the city. Again, as you noted, the real challenges for Baltimore reside in its growth rate, both in population, but of course economically. And this is where just becoming more intentional and thoughtful about how we do our mission, I think we've been able to contribute to strengthen activity in the city.
Do you get people coming to you if you had to have dinner, say, my grandson or son deserves to go to Hopkins and here's the resume, or how do you deal with people who tell you their child is deserving to get into Hopkins?
What I do is I tell them that I think it's great that they apply to Hopkins, but Hopkins ended legacy programs, as you know, in 2018. We were one of the first private universities to do that. Some of you may know, of course, that California, following Maryland, just yesterday passed legislation ending legacy admissions. So we've really sought as much as possible to create a true meritocracy and honor the ideals of Jeffersonian equal opportunity at Hopkins. And so we encourage people to apply, but at the end of the day, the chips fall where they may.
So you seem like you're in pretty good shape. You're pretty thin. Do you run a lot, or how do you stay in shape? You go to the Hopkins doctors. What do they tell you to do?
I do my best, David, to as much as possible to avoid seeing Hopkins doctors.
Okay.
So it's much better to go to the gym than the health system. And so work out daily, do a whole bunch of different stuff in the gym.
So, Brooke, very often people that have had your job want to go run for another job. And have you ever thought of running for another statewide office?
I have not.
Not.
I am very happy where I am. I just got here 20 months ago, and when I was in the General Assembly, I learned about what the Office of the Comptroller could do, and just sort of saw that, it's one of only 3 statewide elected officials, and I thought there was an opportunity for us to reimagine what the Comptroller could do for the people of Maryland and the communities and businesses. And so right now, my team and I are very focused on reimagining how we can create an advocate in the Comptroller's office for, the people of Maryland. So whether that's sharing the resources of the office with communities communities and businesses more broadly, and helping them through the procurement process, which is such an important part of building businesses. Whether we can think big about how we do taxes, whether we can, and through procurement, and just about the earned income tax credit and making sure that we're running the largest anti-poverty program the government has in the best way we can. So I think right now we're really focused on making government work better and reimagining this office.
So do you travel all over the state? Do you go to all the counties every year?
I don't go to all the counties every year because I do have a 1,200-person team that I am managing as well. But we have 11 offices around the state, so I visit them. And I do visit with chambers of commerce and business communities, nonprofits around the state, as my team does as well. And we're really focused as well on making sure that we're sharing the data of the office with the governor, with business and community leaders through reports, which is brand new. The agency's never done this before. So we put out a State of the Economy report this year.
What is the impact on the economy of Maryland of the bridge collapse?
So the bridge collapse had a profound impact in the short term, but because of the Port Act that the General Assembly passed and the Department of Labor and my agency administered, we were able to support our businesses and support the workers in a really profound way. I think actually it's a story of government working well. And so things have come around and things are moving along. Of course, today a strike.
When will it be completely repaired? Is that 4 years away or something like that?
Yeah, I think the governor and the Secretary of Transportation will be here later have said it's going to be a few years.
Okay, and you're wearing orange because of the Orioles, is that?
Of course, lifelong fan. I went to the first game ever played at Camden Yards.
Wow.
My dad took me out of school, and we live 2 blocks from the stadium now. I spent 15 years in Fells Point, but we just moved to Otterbein so we could, walk more easily to the games.
Okay, well, I hope you'll be there today. Suite 33, come to see me. So Louis Goldstein was the comptroller of Maryland for roughly 175 years.
Just about. That's
so-
why I'm only the 34th comptroller, not the 50th.
Do people still think he has that job?
They do. People love to talk to me about their Louis stories, which I love. And, when I was running, people said to me, you're running for comptroller, like that's an office for characters. Louis Goldstein, William Donald Schaefer, how are you going to fill their shoes? And so to look at them and say, well, I wear high heels.
Okay.
So it's going to be a little bit different.
So how many women served as comptroller of Maryland before you?
None. I am the first.
Really?
Yes.
Okay.
I am the first.
All right. So in the University of Maryland hospital system, I assume you have a large Medicaid population. And I assume when Medicaid patients are your patients, you cannot legally turn them away, nor would you want to. But do you lose money when you have Medicaid patients, or do you get reimbursed adequately?
So the uniqueness of the reimbursement system of Maryland, we probably don't have enough time this week to talk about the unique challenges. But one of the benefits of the uniqueness of the model in the state of Maryland is that it is an all-payer system, which says that there is equity and access as a consequence of the unique ways that in the state of Maryland, different than the rest of the nation, hospitals are reimbursed for the services we provide. And so I think it is one of the advantages of the model where leaning into the differential needs of our communities, the reimbursement model in Maryland actually encourages that type of behavior. There is a reality to the challenges of both Hopkins and Maryland that we take on a differential responsibility in those, in serving the unmet needs of our communities. And whether that's here in Baltimore for the medical system or in different parts of the communities that we're blessed to serve across the state of Maryland, that's our reality. But there is no question that one of the challenges that we're all leaning in and taking on is when you think about the evolution of healthcare, equitable access and equitable outcomes to deal with health equity is ultimately, I think, our collective responsibilities. And we're not just doing it as the medical system. We're doing it in partnership with Johns Hopkins. We're doing it in partnership with the hospital industry and the state of Maryland. But there's no question, sir, that the challenge that we have is that there are differential needs based on historic disparities that have existed in our communities.
So you spent your career now in medicine. You have an MBA, though. do you regret not going into the higher calling of private equity?
You know, that's why you have kids. So I hope that maybe one day one of my two daughters might go down that path. But
Right? So when somebody is ill and they need a doctor right away and they go to the emergency room, what's the best way to actually get a doctor in the emergency room to take care of you as opposed to waiting in the waiting room for a long time? Do people come in and say, do you know who I am?
yeah, that usually doesn't work in terms of getting you to a front of line. Obviously, what you're referencing is one of the challenges, not just in Maryland, but around the nation, which is when the emergency rooms are used as the primary access point for healthcare, it's a sign that our healthcare system globally isn't meeting the needs of our community on the front end, which is, you know, what is the access to primary care? What's the access to preventative healthcare? We are still a system as a nation that delivers, I believe, phenomenally good acute health care. When people are really sick, they come to us. But when you think about it, and Ron spoke a bit about this with what Hopkins is doing, and I would say we are equally committed to what does it mean for organizations like ours to be anchor institutions in our communities? What does it mean for us to think about investing, place-based investing, in things like food insecurity, in housing, in education, and workforce opportunities, because that ultimately leads to improving the health of communities.
Recently, Johns Hopkins Medicine announced that I think if students or medical students there, they're going to be able to graduate debt-free, more or less. Is that right?
For students,
For people of certain income.
yeah, for students from $250,000 of household
Why
income.
is that an important issue? Because doctors make a lot of money. Why can't they pay off their debt?
Not all doctors make a lot of money. And again, what we know is that the prospect of taking on debt, particularly it's a second degree, not a first degree, and for those graduates who want to go into low-paying fields in medicine, that the existence of that debt load was a deterrent. So this is a great way of increasing access for the best
Final
and
question
brightest.
for each of you. Let's suppose a CEO calls you up and says, I'm thinking of locating my company in Baltimore. Is that a good idea? What would you say to him or her?
Terrific idea. Terrific assets in the city and state. A real sense of energy around the renewal of political leadership, both at the city and at the state level. And I think a sense of, as witnessed by your investment in the city, that this is Baltimore's moment and this is Maryland's moment.
What would you say?
Yeah. I mean, I have to echo everything that Ron said. Absolutely. You know, my husband and I moved here 15 years ago and never looked back. And so I would say, absolutely, you'll, as a CEO, be able to, you know, get around easily. Your employees will have great schools to choose from. We're working on that. There's more to do. Great parks, great assets, a ready workforce from our universities graduating to work at their companies and more.
What would you say?
100%, I'd bet on Baltimore all day.
Okay, so what's healthier, a crab cake or a Philadelphia cheesesteak?
Crab cake.
Every time.
For sure,
Everybody
crab
agrees.
cake.
Okay, so all of you have done great things to help Baltimore and Maryland, so I want to congratulate you for doing that. You've provided a lot of leadership over the years, and I hope all of you will come to the Orioles games when you can, and hopefully we can celebrate the World Series together, okay?
Terrific.
Excellent.
Thank you,
Thank you.
David.